Have you ever stopped to think about how things like teamwork, strong partnerships, and just, everyone pulling together actually impacts the safety of the healthcare you get? Today, we're doing a deep dive into Strategic Objective 7 from a recent WHO document. And this objective, it's not just policy jargon, right? It's really the WHO saying, look, patient safety isn't a one-person show. It needs everyone, from governments right down to patients, working together in sync. Our mission here is to pull out the most important insights, maybe some surprising facts from the sources you've given us. We want to explore how this global collaboration is actually shaping safer healthcare and, crucially, what it all means for you.
Absolutely. And it's vital to get that patient safety is best improved through a holistic approach. It involves so many different players. When we say stakeholders, we mean a really broad group, not just doctors and nurses, obviously, but policymakers, patient groups, pharma companies, tech people, and yeah, even you, the patient. But here's the challenge up front. Despite all the effort, the global score for this kind of synergy and partnership in patient safety, it's currently just 41 out of 100.
Wow, 41. That
Yeah.
sounds, well, pretty low, actually, given how much we talk about patient safety globally.
Yeah.
What's the biggest hurdle there? Why isn't that number higher? Where are we doing okay, and where are the really big gaps in getting the right people involved?
Yeah, 41 is low, and it points to some real difficulties, maybe in bridging different silos, competing priorities perhaps, or just not having standard ways for different sectors to work together easily. So, get this. About a third of countries say they've identified the key players for patient safety.
Okay, a third. That's something.
But, and this is the kicker, only 17% have actually put effective coordination systems in place to properly engage them.
Only 17. That's a huge drop-off.
It really is. It highlights this major gap between knowing who should be involved and actually, getting them working together effectively.
Right. So if many aren't really engaged, who is making an impact then? Who's actively at the table in this global push, and who are we really missing out on?
Well, we do see strong involvement from, let's call them the traditional healthcare partners, professional associations. They're involved in 71% of countries.
Uh-huh.
And academic and research institutions, that's 62%. So those groups are pretty widely engaged. But connecting this back to that low score, the areas needing significant improvement, definitely the private sector and industry. Now, 65% of countries recognize them as key stakeholders,
Okay.
but only 12% are actively engaging them in national patient safety work. 12%.
Just 12. That's astonishingly low.
It is. And the pharmaceutical and medical device industry, also low engagement globally, around 35%. Think about the innovation, the resources there. It feels like a massive missed opportunity.
Absolutely. An incredible amount of untapped expertise just sitting there.
Hmm.
Okay, so it's one thing to identify partners, but the real meat is how these partnerships actually form and what they achieve, right? That's where the innovation happens. How are we building those bridges globally?
Yeah, exactly. And collaborative alliances are just crucial. A really great example is the Global Patient Safety Network, the GPSN. It's this innovative online platform bringing together over 3,000 professionals from something like 160 countries, sharing ideas, tools, best practices. It's digital solidarity in action.
Impressive reach.
It is, but it also makes you wonder, why do only 21% of countries report having an established national patient safety network? We've got the global connection, but maybe not enough local structure to really harness it.
Interesting point. And thinking globally, those big global ministerial summits on patient safety, they must play a pretty big part in setting the agenda, yeah.
Oh, definitely. Those summits are critical. They drive the international culture, keep patient safety high on the priority list, and you see high-level buy-in. 73% of countries send their health ministers or senior executives.
So they have real clout.
They do, and their impact is clear. These summits, they led directly to establishing the annual World Patient Safety Day, and importantly, the adoption of the WHO Global Patient Safety Action Plan for 2021-2030. That plan provides a real roadmap. It shows global agreement turning into concrete action.
That action plan sounds key. So beyond the big summits and networks, how does patient safety actually fit in with other health programs day to day? Is it separate, or is it kind of woven through everything?
It's definitely meant to be woven in. You can see the alignment with technical programs pretty clearly. Think about the WHO Global Patient Safety Challenges.
Like clean care is safer care.
Exactly. That one, or safe surgery saves lives and medication without harm. These aren't just standalone safety things, they're integrated global efforts. They show how safety principles cut across all sorts of clinical areas. It makes safety fundamental to, well, all of healthcare.
Okay. So Pulling this all together,
Yeah.
what's the main takeaway? The data seems to show a strong push for collaboration,
Yeah.
globally speaking. But that journey from just naming partners to really integrating them, getting them working together effectively, that's still very much a work in progress. So much potential still untapped.
Precisely. And given that we know that leveraging all that collective knowledge and all those resources is absolutely crucial for making real systematic improvements, it leads to a question for you, the listener. What do you think is the single biggest opportunity right now for fostering deeper, truly effective partnerships in healthcare, whether globally or maybe even right there in your own local community, to make sure we get safer care for everyone?